So you're not interested in bedside nursing? Or maybe you hate it.
Why are you crying?
Here are some non-bedside nursing jobs to consider that don't require additional degrees. What is good, YouTube? This is NWA here, Nurse Pat, coming at you with some more heat. Personally, I am an advocate of being a bedside nurse if you're a new grad. There's just too many benefits and growth opportunities, in my opinion, when you're at bedside. However, bedside isn't for everyone.
That was your Filipino mom's dream. You can't have a dream. What are you talking about, dream? Hey, follow me to the X-ray. I'll follow you.
Was it my dream? I don't know. Was it my dream?
My life be like, yeah.
So maybe you could consider these choices as a full-time position, or if you want to just reduce your amount of time working as a bedside nurse, reduce your hours, your days and stuff, and pick this up as a side gig. So what are some options for you? I technically got 12 options here for you to consider. So being a home health and hospice nurse is one of them that I would consider. I spoke about this a little bit in length in my previous video, so if you haven't already, check that out if you want to. This is more of a case manager-like role and less direct patient care. You're going to be visiting patients one at a time at their houses, care homes, assisted living, and also SNFs. Option number 2 is being an infusion nurse. So similar to home health and hospice, you're going to be mobile. You're going to be doing treatments for patients, infusing blood transfusions, chemotherapy, steroid infusions, electrolytes, vitamins, etc. You're going to be managing their PICC lines, midlines, and also central lines. Option number 3 for you is being a cosmetic nurse. So with this, you're going to be working with a doctor or nurse practitioner for cosmetic type procedures that aren't too invasive. So these include Botox, laser hair removal, collagen injections, etc. Option number 4 is being a school nurse. If you like kids, if you vibe with them, maybe this is an option for you. You're going to be managing actions that need to be taken for students that are either sick or wounded, and you're going to be determining whether or not they just need simple interventions, or they need to go home, or if they need to see a doctor. Option number 5 here is being a nurse health coach. So what you're doing here is you're going to be having clientele, and you're going to be managing them with their health goals. So you're going to be working with their care plans, interventions. You're going to be educating them on their diet, medications, a lot of preventative care. Number 6 is you could be a public health nurse. These type of nurses focus on preventative care for the community. So you could be managing patients in their homes with community-acquired illnesses that are contagious, such as TB. The next 6 options I'm going to list are in the hospital and may require some bedside experience. First one up is IR, Interventional Radiology. So as an IR nurse, you're going to be dealing with chest tubes, image-guided nasal gastric tubes, G tubes, GJ tubes, biopsies, stuff like that. You can also be a Cath Lab nurse. This type of job is pretty cool in my opinion. You get to work with patients that need like cardiac stents. An OR nurse. If you like being in the OR, you don't mind the blood and gore, and you find it interesting, being an OR nurse would be pretty cool. You get to assist the surgeon and see exactly what's going on when someone has a surgery. PACU nurse. Being a PACU nurse is basically when the patient comes back from surgery, right after they have to recover, you make sure they're stable before they go to a unit, or if they were to go home. Preop and short stay nurse. So these type of nurses work with patients, managing them with their same day surgery cases. So these are outpatient. They come for their surgery, they come back, make sure they're stable, and they go. These are generally less invasive type surgeries that are very minor. And the last one is working at your hospital's employee health. It seems pretty chill to be able to work with employees, and you'd be doing stuff like flu shots and whatnot. So I know that was a lot. These are a ton of options to consider, but even then, there is so many more avenues that you can take rather than being a bedside nurse if you don't want to. Let me know what you think. Are these some options you might consider as either a side gig or as your main job? If you're feeling the content, be sure to comment, like, and subscribe. Check out my other videos if you haven't already. And as always, stay safe, stay humble. I'm out.